you need to be careful. It can be daunting in a solo practice. So I advocate that you have a team. You have some method in place how to handle patients like this. Otherwise, you'll burn out fast. You tell them that you're a physician. If you want to maintain this relationship, you need to have boundaries, and that I will prescribe you if it's appropriate, but I need to assess you first, what's going on. And then after assessment, if they still need opioids, you don't give them too many pills. You give them possibly for a few days. In fact, I've done day at a time in some patients who don't have control, what I call as a chronic urge problem in this patient, because they have urge, right? This is a chronic disease. This addiction and dependency, chronic disease. They have urge. They do anything to secure those medications. So I will go over them, telling them that you have this urge problem. You probably a network has changed, so probably because of your lifestyle, possibly, or some things we don't understand. So we need to work on those networks before I give you opioids. So you need to have a lot of counseling sessions with them and try to understand where that urge is coming from. So your job is to diagnose those urges and see how you can control those urges. So it's going to be a long and persistent sessions with this patient. So that's why you need team, because not every physician is trained to counsel patients, right? And they're not used to seeing this kind of patients. And physicians generally are giving, and they want to make patients feel better. They're not in the business of stopping people, right? They're not in the business of saying no to people. So they become vulnerable with patients like that. So this is all the more reason to have a team. So it's a teamwork rather than individual management in these patients. And then you set the rules and tell the patient the rules that you have to, these are the rules we follow for giving opioids, and then manage that patient. And it may involve frequent visits, it may involve urine drug screens and other things that you set in your rules.